Let me be brutally honest with you. When it comes to practice-ready assessment programs across Canada, most international doctors don't fail because they are unqualified. They fail because of their CV. And it's not because they don't have the experience. It's not because they didn't pass the exam. No. But their CV looks very confusing. Their CV looks incomplete, or their CV is inconsistent. And that is why today I want to talk to you about this topic. Common practice ready assessment CV mistakes. Common PRA mistakes. Let's go. Okay, so now let's get this thing going. These are the very mistakes that quietly disqualify many candidates from the various PRA programs across Canada. Okay, so let me just dive into it right away. Mistake number one. Mistake number one is when candidates copy generic templates from the internet and they use it. Listen, a PRA CV is not a typical job CV. It's something you have to understand, right? You are not applying for a clinical job. Rather, you are proving your eligibility to practice medicine safely in Canada. And those templates that you find on the internet, they often miss the structure that provincial assessors are looking for. And when you use those generic templates on the internet, you might end up listing irrelevant information like your marital status or your hobbies, that things that Canadian reviewers don't really care about. And your CV should focus on only one thing: your readiness to practice medicine in the Canadian context. Everything else is just noise in the ears of the one who is reviewing your CV. So please avoid copying generic templates on the internet word for word. It's not necessary. Number two, when candidates miss or have misaligned dates. What do I mean by this? So I see this all the time. For example, the candidate worked from 2018 to 2021, but on the certificate, on the CV, it says only 2009, which is which? In the body of your CV, you said 2018 to 2021, but when you were writing the date, you just wrote only 2019. Your intention rotation, they usually overlap, or are they unexplained gaps of 6 months with no note in it? These are the things you have to start paying attention to, because you know what that tells the reviewer. It's like, this doctor is inconsistent. Possibly this doctor is careless. And medicine is something we want to pay attention to details and pay attention to the patients, right? So in Canada, dates mean credibility. So every date on your CV should match your official documents perfectly. So whichever official documents you have, your medical school transcript, your medical license, your passport, all these things, you have to make sure that the dates align very well. And if there's a gap, you've got to explain it honestly. Were you studying during the gap year? Were you volunteering? Were you taking care of family? Say it as it is in a CV so that people can follow the story. And don't allow people to fill in those gaps which you've not explained, because silence makes people assume the worst. Maybe this doctor has something he or she is hiding, right? Number three, the third mistake is writing like a student instead of a professional. And this one hurts me so much when I see it in various candidates and their CVs. Why? Because I've seen brilliant doctors, I mean very brilliant doctors, who undersell themselves with poor phrases. For example, they write something like attended ward round or observed patient care. Well, that sounds very bleak and very, simple. That makes you sound like a medical student, not a practicing physician. So what you should rather do is use confident and active words like managed acute and chronic cases. Look at the language, like performed minor surgical procedures. You're putting some spice in there, like led patient consultations and treatment planning. Okay, now people get to know that you are speaking confidently. That's the language of a competent doctor. You're not just speaking like a medical student, you are speaking like a confident doctor. Remember that, the tone you use in your CV tells the reader how you see yourself. And so find a way to sell yourself so that anyone can buy exactly what you're selling to them. And if you sound unsure, they'll assume you are not ready and you can't join their team. What's the fourth mistake I want to share with you? Forgetting non-clinical experience. Because most IMGs are focusing on only what they did so far as patient care is concerned. Many think that if it's not clinical, it doesn't count. But no, that's not true. Especially when you are looking at a country like Canada. No, every other thing matters. So if you've done research, put it in there. If you've done teaching, put it in there. If you've done community service, put it in there. Even if you did administrative work, put it in your CV because it tells a lot about you. Because you know what? The practice ready programs look for well-rounded doctors, not just people who can diagnose, people who can treat patients, but they're looking for people who can lead a team. They're looking for people who can teach because in your community, they may send a medical student to your community for observership. So you must be able to demonstrate that, look, when a medical student is brought to me, I can teach that person. You must also show in your CV that you can collaborate with other people, nurses, physiotherapists, occupational therapists, psychiatrists, other specialties, dietitians, diabetic educators, home care nurses, right? Because I've seen candidates get shortlisted because they included the volunteer work that showed their community engagement and leadership. Because don't forget, if you're a doctor in a community, you're also seen as a leader. And you've got to be able to demonstrate in your CV so that you're not just being recruited by the clinic, you're also being recruited by the community. So don't delete the non-clinical experiences you've had. They are very, very important. And in many cases, that is what will set you apart from other people. Now, the fifth mistake I see is when there is a weak or a missing profile section. What do I mean by this? Your profile, those 2 or 3 sentences at the top is your hook. That is what you use to grab the attention of the people who are trying to recruit you. So you need to make sure that it is solid. It is your chance to summarize your whole medical practice in a few lines. So far as the Canadian context is concerned. And many IMGs skip that entirely off. And the worst thing is they'll write something like hardworking and dedicated doctor. When you write hardworking and dedicated doctor, that tells the reviewer of your CV nothing, right? Instead, you have to write something like this. I'm a family physician. I've worked over 9 years with experience in primary and emergency care across diverse patient populations. I'm passionate about patient safety and clinical excellence. When you look at these 2 examples, you realize that there's a big difference. One is sharing his or her story, the other one is just listing something which is very generic. And that line is what sets the tone for the entire CV to be read. Because if I pick your CV and I get to know that this is what you've written, I'll go like, okay, looks like there's something here. Let me take my time and review this doctor's CV. All right. Mistake number 6. Mistake number 6. Overcrowding and clutter. What do I mean by that? Your CV is not a novel. You don't need a list, every course, every clinic, and every patient you've ever seen in your CV. No, it is not a novel, a big novel you are writing. Canadian reviewers are looking for clarity over volume. Okay. So use white space, use bullet points, use consistent formatting in your CV so that people can actually follow and go like, oh, okay, I like this, I like this, I like this, I like this. This is something very important because if your CV looks like a wall of text, remember, nobody is reading it. And your goal is not to impress with words, it is rather to communicate clearly so that people will know exactly what you're talking about and then take action based on what you've said. I hope you're following me. So let's go to problem number 7. Mistake number 7 is when people do poor file naming and presentation. What do I mean by this? You've probably seen this file. The name is CV, final new document. It's like, what is this doctor trying to say? Or they will say something like resume for Canada 2023 PDF or resume for Alberta 2025 PDF. Come on, doc. This looks so unprofessional. It's so unprofessional. Rather, this is how you have to label your CV. You have to have your first name, a dash, your last name, another dash, CV.pdf. This is very important. Okay. So your first name, there's a lowercase dash, your last name, a lowercase dash, CV.pdf. This tells the assessors that you are very organized And that matters. And don't forget to proofread, read through your CV at least 10 times and make sure that all mistakes are corrected. And then give it to another person to also read through it. Because a single typographical error can raise questions about your attention to detail. And as a doctor, you have to pay attention to detail. So read it out loud, read it while you are walking, show it to your wife, let your wife read it to you, let your child read it to you. Make sure that every typo is checked. And if possible, get somebody who is a professional in CV writing to also overlook it. And we are here to help you. So don't forget that your CV is a reflection of how you work under pressure. So let me tell you a quick story. A few months ago, I had a doctor from South Africa. He's called Dr. Lunga. He read out after being rejected twice, and he said, Dr. Broni, I don't know what is wrong. I met all the criteria. My CV is good. Everything is right. Why was I rejected? And then I reviewed his CV, and it was full of these mistakes we just talked about. The copied format, he had missing dates, there were vague duties he was just talking about. So what we did was that we restructured everything together. We made it make sure that it was very clear, it was very precise, and it was very professional. The next application cycle, boom, he was accepted. And you know what he said? He said, I didn't change my career. I just changed how I presented my career. And that is what got me in. So that is the power of a well-built practice-ready assessment CV. So, my friend, if you've gotten to this part of the video and you're applying for any practice-ready assessment program, here's what I want you to remember. Remember these things. Number one, be current. Be current. Include all your activities since you graduated. Number two, be complete. Don't leave any unexplained gaps. Number three, be clear. Use very simple structure and confident language. And if you do that, your CV won't just get noticed, it will get remembered. Remember that. Your CV will get remembered. Always remember that you want to make an impression. Always remember that. Okay? So at MedCognito, we've helped hundreds of doctors fix these mistakes in their CV and build a practice-ready assessment CV that stands out in every province. So before you submit your CV, bring it and let's take a look at it. Bring it. Let's take a look at it. Because sometimes it's not your skills that hold you back. Your skills are good, but your CV is pulling you down. Okay? So click the link in the description to book your PRA CV review session with our team members. And we'll be ready to help you to build something very good. Because your first impression can change everything. And let's make sure that it screams, hey, pick me, I'm ready.